Right now. Good morning. Good morning, everyone. Thanks so much for coming. If you could find a seat. Maria, if I can ask you to maybe shut one of the doors, and once we get going a little bit, we'll shut the other at the time we start the movie. Well, good morning, everyone. Thank you so much for coming to our Healthy Eating, Active Living Workshop number 1. You guys were doing so well doing bingo. I'm not going to ask you to stand up and do, jumping jacks or something else to get us going. There's a lot of good energy in the room, and we really appreciate your time and commitment for coming out this morning. My name is Kathy Capriola, and I'm wearing 2 hats today. I'm the Assistant City Manager for the City of Novato, and then I'm also here in a client capacity. I'm a member of the Chamber of Commerce Leadership Novato Project 2014 class, and with that, we actually, the group of about 20 folks that are in leadership, we get divided into teams. So there's 3 teams this year, and within each team, we look to see what project we want to try to do to benefit the community and work alongside an organization. And so our group of 6 chose to work with the city, and Pam Chenault is the Director of Parks and Recreation and Community Services, and she's our client for the past few months. And so basically our team is assisting Pam in really launching a more community-based healthy eating, active living program in conjunction with the Parks and Recreation Commission. So we're delighted that you're here, and I'll introduce the team in a few minutes as well. Again, let me kind of remind you why you're here, and I really want to be thankful for the time you're putting in. The purpose is we've got 2 work sessions, and the purpose at the end of these work sessions or workshops is basically to give Pam and the city data, information, and insights about how to create not a strategic plan, but really a work plan. We want this to be practical, we want it to be realistic, and we want to be able to implement it over the next, say, 3 years. So we're really we want good visioning, but we also really want it to be things that we can marshal through and get done. So that is the purpose of the 2 sessions. The first session really is focused on opportunities, barriers, ideas, kind of looking at an assessment. And then the second workshop, which is in 2 weeks and the following Thursday, is to begin to take that information, which we'll theme up and send back out to you before that follow-up workshop, and really look to say, okay, what are the themes? What are strategic objectives? What are some goals or projects that we could implement? So that's really that's the purpose of why you're here. We are going to ask you to roll up your sleeves and work, and really appreciate the time. So in terms of the agenda, the 2 things you should have in front of you is make sure there is the agenda, and this is what we'll be following today. And then there's also this healthy eating kind of the beginning bare bones of a vision and benchmarks and themes. This is some work Pam's done that kind of is a little bit of an umbrella that we'll be working with. So let me just kind of tell you a little bit what the agenda is going to be, and then we'll get started. So we do have some information. This is a complicated and very data-rich area, and yet there's so much you can do in these topics that pretty soon you can get lost and try to do too much. So we're going to give you some stats and information to because we have a variety of experts in the room. Some of you, could be sitting up here doing these presentations, and some of you may not have had much exposure. So we have 3 different presentations to give you an update, an overview, and then we're going to start a conversation about what does a Healthy Novato look like as a group, and then we're going to break you into 3 groups. And the groups will be focused on kind of 3 areas of themes that we think the work plan will be built on. And those 3 are listed at the bottom of this healthy eating. One is infrastructure, capacity building and built environment, healthy food culture, healthy food access, and physical activity, personal wellness, and employee wellness. So we're going to be breaking into 3 groups around those topic areas, and that's really the small group work that you'll do. And then we'll share conversations and things you learn from each other in those small groups, and then we'll break. Our goal is we will have you out of here at 11:30, if not earlier. So we'll definitely be respectful of your time. So with that, I'd like to introduce kind of the team, talented team that I've been working with and has been fabulous. Pam Chenault is our client, as you've heard, and I think, Pam, if you raise your hand if you didn't before. And then if I could have Jason Lau. Jason, you want to raise your hand or come up? Jason is the Director of Community Education, Lifelong Learning, and International Education with the College of Marin. Jason did the fabulous movie you'll see at the beginning. Gary Apelsis is the owner of An Apple a Day Health and Wellness. Maria Aguila is on a Board of Education trustee with the Novato Unified School District. Leslie Biagini and Salazar is the CFO of AJ Paint Masters Plus. And Mickey Peterson is the Associate Executive Director of the Marin and Novato YMCA. So a very talented group of people, really natural links to this topic, and so we're delighted to be here. So with that, I think I'm going to turn it back over to Jason in just a minute. I do think it'd be helpful for everyone to basically do some brief introductions. I know you did human bingo, but you might not have gotten a little more, maybe what people do in their official capacity. So everyone, if you wouldn't mind kind of sitting or standing, your preference, if you could say your name, what organization you're with, and maybe what your interest in this topic is. If you could try to keep it, fairly brief, because you'll have a lot of time to dialogue more about the details. But Bob, would you mind starting?
Good morning. Good morning. I'm Bob Brown. I'm the city's Community Development Director, and I'm thrilled with this process because we're rewriting our general plan. And as Pam has repeatedly told me, one of the major themes will be healthy eating, active living. And so what comes out of here today is really going to inform that process. Thanks.
Good morning. I'm Jeanette Longton, Senior Director of Healthy Novato Project. And what Healthy Novato Project is a community health initiative to reduce underage drinking in Novato. And I'm really interested in this topic and glad to be here today. Thank you for letting me come. And because healthy living, of course, underage drinking and excessive adult drinking is a big part of us learning how to live healthy. And I don't know if you all saw the recent statistic for Marin County, but it was quite shocking. We're a very healthy county, but not in the area of alcohol use, so it's something we really need to work on.
I'm Gail Howard. I work for Novato Unified School District, and I'm a school nurse. I'm also a wellness ambassador for our wellness committee.
Hi, I'm Rebecca Smith. I work with the Department of Health and Human Services, and I'm a program manager with our Healthy Eating, Active Living initiative.
Hi, I'm Rebecca Markwick, and I work with the City of Novato's Planning Division. And like Bob mentioned, I am also interested in implementing this program through our general plan.
Suzanne Juilliard. I'm a parent in the district. I'm also a registered trauma nurse. I'm with the NMC PTA board and just a parent in the community.
You're not just a parent. Hi, good morning. My name's Shaleigh Cunningham. I'm superintendent of schools for the Novato Unified School District. We have 8,000 students, and our focus is certainly healthy living and active student body. We have many schools right now that are implementing activities in the morning before school even begins, because we know that that helps clear out the cobwebs and makes our kids ready to learn. Thanks.
Good morning. I'm Leslie Benjamin. I'm the Public Information Officer for the Novato Unified School District.
I'm going to sit because I have a bum foot. I'm Jenny Party. I work for Conservation Corps North Bay, and I manage the Indian Valley Organic Farm and Garden on the College of Marin campus. I also am a parent at Loma Verde Elementary School with Suzanne, and started the Loma Verde Elementary School Garden. So I'm a huge advocate through my work and in the community for starting up and supporting school gardens.
I'm Marian Shinsky, and I'm Executive Director of Novato's Spirit Athletic Scholarship Program for low-income youth. I serve all the Novato population here, and what I do is offer 5-year scholarships for Taekwondo, karate, dance, soccer, and basketball, keeping kids active for 5 years. Most of the kids are referred to me through Marin Community Clinics. Most of my kids are pre-diabetic, obese, some are diabetic, have a lot of chronic illnesses such as asthma, motor skill problems, and mental health issues. predominantly depression. So anyway, what I do with these kids is get them to sign up and commit to a sport for 5 years, and we've had some good results regarding weight loss, self-esteem, self-confidence, toning up if they're not already, if they went in not being obese. And I'm really interested in what you're doing and feel very grateful to be invited. I have some flyers, informational flyers in English and Spanish, if anybody's interested in learning more about me. Thank you very much.
Hi, I'm Mary Strebig. I am Community Relations Manager for Novato Community Hospital, and among my responsibilities is community benefits for the hospital. With the Accountable Care Act, all not-for-profit hospitals in the United States are required by the Internal Revenue Service to every 3 years complete a very robust community health needs assessment and make that publicly available on our website. We work in concert in a coalition called Healthy Marin Partnerships with the other 3 hospitals in Marin, Kaiser Permanente and Marin General Hospital. We have a 110-page report on our website that you can see, and then we have a 3-year implementation plan. I gave hard copies of that plan to Gary earlier today so he can share that with your committee. Among the priorities, each of the hospitals, we did the report together, the Community Health Needs Assessment, the CHNA in 2013. It's very robust, and it has included in that maps. Healthy eating, active living is one of the needs that we identified for Marin, and then each of the hospitals identified their own priorities for their community benefits plan. For Novato Community Hospital, our #1 priority is access to health care, and the other top priority for us, we have several priorities, but our other top priority is healthy eating, active living. So we're absolutely delighted to have this opportunity to participate in this project with you. And we do have data with maps that will show you the areas of Novato where there is the greatest need for intervention. Marin is a very healthy county overall, as you all know, but there are pockets of Marin and pockets of Novato where there is great need for intervention in various ways to make it possible for people to have a healthier lifestyle.
Hi, my name is Heather Sorber, and I work at the Novato Youth Center. I actually just got a promotion, so I was the assistant program manager for our ECE and school-age programs. We serve 18 months through 14 years old. And starting next Wednesday, I will be the ECE program manager as well as the food program manager, which is more importantly why I'm here. So yeah, thank you.
Good morning. My name is Linda Jackson. I'm with the Transportation Authority of Marin. We fund transportation improvements throughout the county, and specifically here in Novato, we have a couple of projects we're embarking on. One is an update to Novato's bicycle pedestrian plan, and that effort is in sync with your work on the general plan to update that. And then the other one is to do a community-based transportation plan, which is specifically to improve mobility for low-income residents. So I'm thrilled to be here today and to be able to see how to, what are the infrastructure ideas that come out and ways that we can help support Novato. Thank you.
Good morning. My name is Jane Johnson, and I work with the YMCA. I'm the Director of Youth Development. Really happy to be here. I'm going to be talking to a few of you. We have 8 childcare sites in Marin County, and I'm in charge of the Novato sites. So we serve over 800 children each day. And we have a program, internal program called HEPA, it's called Healthy Eating Physical Activity. So it's really in alignment with everything that we're talking about today. So we've implemented some really good, strong practices in our child care sites, and would love to share some of that with you when we have a chance, but also looking for other resources on how to really spread the word. And we're also looking at building a community garden and having a garden for the children to kind of learn where their food comes from. And so I'm excited about just being here and being part of this. So thank you.
Good morning. I'm Liz Watson. I work with the Chamber of Commerce, and I have the privilege of working with these folks intensively one day a month through leadership. So This is a great group of people with a lot of good skills to bring together. Thank you.
Good morning. I'm Corrine Mulerath, and I am the School-Based Prevention Coordinator for NUSD and also work with the Healthy Novato Project. As Jeanette mentioned, our main purpose is to prevent underage drinking. And we know that our kids in Novato are starting drinking, dabbling in testing the waters with alcohol as early as 5th grade. That's where we have data, but it could be even earlier than that. So as we think about holistically, how do we help the whole child? How do we help kids make healthy choices around food and eating and exercise? We really want to impress upon the young children the importance of taking care of their body and preventing any further brain damage or any impact in their lives by avoiding alcohol completely and drugs as well.
Hi, my name is Wendy Callens. I'm the program director for the countywide Safe Routes to Schools program, which is part of the Transportation Authority of Marin. And our goal is to create a culture of walking and biking as a normal part of getting, not just getting to school, but everyday life. We like to call it active transportation. And of course, that's physical activity. Again, the same as, getting that exercise early in the morning clears the mind, clears the cobwebs. And at the same time, we want to create safety. And so we work with the City of Novato and the school district to identify where there are barriers, where there are safety impediments, missing sidewalks, unsafe crossings, in order to improve that. And then we assist in finding the funding to actually implement those things. We have instructors that come into the classroom and teach the children about safe walking and biking. And the current program we're working on, and where I'm most looking for assistance, is our neighborhood school pool program, in which we want to organize on a neighborhood level so that people can find other people in their neighborhood and share in the responsibility of getting their children to school and forming these walking school buses, bike trains, and carpools, so that not only, on our special event days do people walk and bike to school, but it becomes the natural thing to do, and it becomes easy and actually frees up the parents' time because they don't have to be getting their kids to school every morning when they're sharing it with their neighbors. Oh, and finally, we have just hired, for the school pool program, I have just hired, actually contracted with a woman who has been with the school pool program in Kentfield, who is bilingual. And so we're especially wanting to reach out to the Hispanic community and get them and work to organize with them as well. Thank you.
Hi, my name is Kim, and I'm health educator. I work with Marine Asian Advocacy Project of Community Action Marine.
Hi, I'm Nancy Weber, and I'm with the City of Novato Recreation, Cultural, and Community Services Commission. And we have a couple of commissioners here today. Thank you for coming. We're looking forward to sharing our ideas and then also implementing them in the City of Novato.
Good morning. I'm Brian Garbett, also sitting on the commission with these fine people. And I'm retired. I have some time on my hands, so I'd love to help out with a project that'll make Novato a healthier place to live.
Good morning. I'm Bill Klein, also on the commission, and my particular interest at this point in time is physical facilities to accommodate the adults and children who need physical activity and promote the healthy living part of this.
Good morning. My name is Paula Neese, and I am also on the Parks and Rec Commission. And I have a particular interest in seniors in Novato. I've worked with seniors most of my life. And my personal dream would be for someday for Novato to have an aquatic center or pool for just specifically for our seniors and disabled. Thank you.
Good
Morning, everyone. My name is Teresa Edashami. I work here for the City of Novato in the Parks and Recreation Department. I'm the Center Director for the Margaret Todd Senior Center, which is right down the way, where we have programming such as classes and activities, as well as drop-in groups for socialization for adults and seniors.
My name is Ana Ortiz, and I work for Novato Humane Center. I'm the case manager at Novato Humane Center. We have a food program on Tuesdays. We get the food through the food bank, so I'm interested in learning what all of you have to say. Thank you.
Wonderful. Thank you all for taking the time. Amazing, rich group of people. Very exciting. It's going to be really fun to get in small groups and have you all start some conversations. So one thing I forgot to mention at the very beginning, we are recording the first part of this session up through, on your agenda, up through what does Healthy Novato look like. Once you break in your small groups, we won't be recording anymore, but Dean Kendrick with our contractor that records all of our city public meetings is recording this. The purpose is so we can put it up on a new website that we've built, and I want to thank Jason again for his technical prowess there. So there's a HEAL website we've built to try to help this initiative move forward once we are done with our assignment in a month. And for people who couldn't be here today but want to see the presentation or understand, they'll be able to go on and watch. And then it's also a place where if there's other information to post or resources such as the hospital, or it can be kind of a resource location as we move forward. So with that, I'm going to turn it to Jason Lau, and we'll keep moving. Thank you.
All right, thank you, Kathy. I thought that when I would look at the agenda, it was hard enough to follow Kathy, but after to hear all you talk and introduce yourself, that's amazing that you even follow the whole group. Again, my name is Jason. I represent the College of Marin here. I'm also part of the Marin Chinese Cultural Association and also the Chinese American Alliance, Asian American Alliance of Marin. So I'm really here to learn and hope to get a lot of information out of these two workshops, and so I can help bring back to the Asian community as well. So honestly, I'm not the expert in this subject matter. The experts are actually in the audience. That's why we decide when we actually talking about a group project, how we want to get started. Should we talk about the data, the statistic, and really, I hear already during the introduction, you have already a lot of information, very rich information, a lot of statistics. So it's really not for us, we decided not for us to really tell you more because you already know a lot. Because today is really to hear from you. We want to hear from you. We want to hear your idea, what you're already doing, so that we can put this action plan together. However, we did a little kind of slideshow, a little presentation just to help get today started. So I hope you'll enjoy it. And then we have two wonderful speakers afterward, and then I will introduce as well. So let's get started. There you go.
Obesity is epidemic in the United States and a major cause of death, attributable to heart disease, cancer, and diabetes. At its simplest, obesity results from people consuming more calories than their bodies burn. But it's a more complex problem than that. People didn't decide to become overweight. Their weight gain is a consequence of complicated changes in the environment, where food is more readily available and opportunities for physical activity are lacking. There is no simple solution to the obesity epidemic. People need to make better choices. But we also have to change those choices in our schools, in our childcare settings, in our work sites, and in our communities.
As you can tell, we're not the expert, so I got the volume up and down a little bit. So I hope this really can be the opener for today's discussion. So without further ado, I want to introduce our first speaker, Rebecca Smith. She's the Marin County Human Services Program Manager for our HEAL initiative. So Rebecca. Use the microphone, you can use it here, and then just on off switch. Would you rather use that? Okay. Okay.
Actually, I'm going to be right here anyways.
Okay.
Thanks, everybody, for having us.
Rebecca, you need a mic because we're recording.
Testing, testing.
Version to the microphone, really, honestly. Hi, I'm Rebecca Smith. I work with the Department of Health and Human Services. I'm really happy to be here today with all of you, and really want to acknowledge Pam and her leadership and the work of the leadership group to be working on healthy eating and active living as a local issue in Novato, because we know that these issues are completely local issues, that the places where we live, work, and play shape our health. And that's what the Healthy Eating Active Living initiative that we coordinate countywide in Marin County is all about, is about shaping our environments to help improve health. About 2 years ago, the County of Marin convened partners similar to this, but on a countywide level, pulling together folks from local schools, from early childhood environments, from local agriculture, local farmers, transportation folks, elected officials, health officials, et cetera, to say we need a countywide roadmap for promoting healthy eating and active living in our community. And, you know, we all know that there's an obesity epidemic. What we wanted to do is to really look at what are the assets in Marin County. We have an incredible amount of assets and resources in our community with our parks and open space and our local agriculture and our health-mindedness and walking and biking infrastructure. And how do we pull that together to have a asset-based approach to looking at healthy eating and active living in our community? So I think not everybody got one of these. We'll pass them around after the meeting, but after the presentation. But the Healthy Eating Active Living initiative is the county's first countywide coordinated roadmap to promote healthy eating and active living in the places where we live, work, and play. So Health and Human Services convened partners in the spring through the fall of 2012. Pam was there actively participating, representing Novato. And we pulled this together because we know that 1 in 3 kids in Novato, in Marin, are overweight or obese, and that there's a huge financial impact in addition to the quality of life and health impact. There's also a financial impact, so we saw the cost federally for obesity, but in Marin, this is $229 million a year, the impact through lost wages, through healthcare costs, et cetera, huge. We also know that if we begin to invest in health, that prevention-related investments have really, really good return on investments. So the Healthy Eating, Active Living plan is about prevention. We know that the factors that influence our health, we have our access to healthcare, we have genetics, but 70% of the factors that influence our health are preventable factors. So either through behavior, through the choices that we make, or through environment. And environment is really about shaping our choices so that the healthy choice is the easy choice. So 70% of those factors are preventable. And you see this return on investment. If any of us had our retirement in that kind of account where $10, we get $56 back within 5 years, we'd all be banking on that. So what we did is we pulled together over 70 different partners from all different sectors. Planning process very similar to this. We looked at local data. We talked about what are the needs and experiences in the field, what are the priorities, what are the assets that we can build upon, and we developed the HEAL strategic framework. And the strategic framework includes some guiding principles for how we do our work. It includes strategies for success and approach for moving forward. So in terms of the guiding principles, and we spent a lot of time really talking about this, one of the things that we really recognized is that we really want to reduce disparities and promote opportunities for all. And Marin County has been recognized again for 5 years in a row, the healthiest county in the United States. But this is not the case for all Marin residents. And so we want to be able to focus our efforts in places where the need is greatest. Oh, sorry, I'm not realizing there's animation here. We know that the obesity epidemic disproportionately affects African American and Latino youth, and that not all communities have the same chance to be healthy. So as we got into this work, what folks in the room through the countywide planning process really wanted was more and more local data. So that's what I'm sharing with you today. Mary talked about the Healthy Marin Partnership data, and the report from the 3-year needs assessment actually provided us with some really, really incredible neighborhood-based data, which in Marin, in a small community, it's really hard to get really good, solid, rigorous neighborhood-based data. So we have some of that data for Novato to kind of show what's happening in different Novato neighborhoods. So just to start with, this is life expectancy data. It's actually, this is from the Portrait of Marin analysis that Marin Community Foundation did a number of years ago. But this is basically looking at life expectancy in Marin, and you see there's a huge gap of 15 years between our community in Marin and Ross with the longest life expectancy. And all of the Novato neighborhoods, the green bar, you'll see this green bar across all the slides that I'm sharing. The green bar is the county average. So all these Novato neighborhoods are below the county average for life expectancy. So this is a graph showing overweight and obesity among youth, 5th, 7th, and 9th graders, and this is from the California FitGram. This is really good, rigorous data that we have to be looking at overweight and obesity across the county. The FitGram happens in phys ed classes every year, so we have really good trend data. And again, this is where we get the 1 in 3 kids in Marin are overweight or obese, but we see again in Novato for 5th, 7th, and 9th graders, that number is closer to 40%. So This is adult, some of these slides are out of order. Sorry, here, I'm gonna skip down here first. So here's our adult overweight and obesity data. I guess this is just the obesity data. This should be overweight and obese. So again, we see the county average with that green bar there, and communities in Novato with as many as 1 in 2 adults overweight and obese. And the interesting thing is that for all of these indicators that I'm sharing, that Novato actually has poorer health outcomes than the county on the whole. Again, so looking at physical activity, moderate physical activity over the past 7 days. These are Novato neighborhoods, all scoring below the county average. We threw San Anselmo in there as a comparison. But you'll continue to see in this data, and I know your handouts, it's probably really hard to, I don't see, we'll make sure people have the handout packets too. It's hard to see the little data, but we'll send it out to you all as well so that you can have an electronic version. But it, very similar kind of neighborhoods where we're seeing these poor health outcomes repeated, in southern Novato in particular. And what we know is that there's a health-wealth gradient, so that health corresponds very directly to folks' socioeconomic status.
Rebecca, you got a question. You got a question over here.
Sorry, I was looking for one of my slides here. Yes. Sorry, those are the census tracts. It's extraneous. That shouldn't even be on this slide. It's a little distracting, but yes. Yeah, no, this is by census tract data, and so those are the tracts. This is a particularly disturbing slide for me. We know county-wide that food is much more expensive, as is everything else in Marin, but food, the cost of food for a family of 4 is 48% higher in Marin than the rest of the nation. So that's a huge impact considering how much of a family's income is spent on food, and that among low-income families, 1 in 5 families in Marin had to skip a meal because they couldn't make ends meet. And then if you look at the data by neighborhood, Linwood neighborhood, among low-income residents, it's as high as 40% of low-income families. So those are families under 200% of the federal poverty level, but knowing that that's happening within Marin County, I would say that the rest of Marin doesn't know that that's reality, that food security is actually an issue here in Marin County, but when 2 in 5 families are having to skip a meal regularly, that's a huge impact. And we also know that then that shapes people's health choices. Yeah. Yeah.
Repeat the question.
So the question was, why are food costs so much higher in Marin? And, I don't know if I'm really qualified to answer that question. I mean, there's just, I think, a premium that we all pay for living here. And certainly, food retailers also have to pay retail space. So just, the price of real estate is going to impact everything. I think that there are in all communities, distribution issues that are not as effective and efficient. You know, and I know that there's concerns locally in terms of the drought and other kinds of food costs that you know, are even our local foods that, you know, we're impacted by so many issues. Bob, yeah. Yes.
Two of those census tracts stand out so glaringly. Any rationale as to income levels, ethnicity, why are those two census tracts standing out?
What do you think? Do you have any guesses? I don't know Deer Island. I don't know that community. But you know, I know Linwood is, you know, a low-income community, and the health wealth gradient. You know, we really know that all health outcomes are really directly impacted by socioeconomic status. Wendy.